Dermatillomania, also known as excoriation disorder or skin picking disorder, and trichotillomania, also known as trich or hair pulling disorder, are both characterized as obsessive compulsive disorders in the DSM. Trichotillomania is diagnosed when the patient compulsively and repeatedly pulls their own hair out, resulting in visible hair loss. An example of this is seen with this patient. During her assessment, she claims, "I have to pull out my hair so my scalp won't hurt." The patient began pulling out her hair when she stopped taking her psychotropic medications 6 years prior. With trichotillomania, it isn't just pulling hair from your scalp. It can include pulling hair from your eyelashes, arms, your legs, and your eyebrows. Some people with trichotillomania will chew or eat at the hair that they pull. A risk of this is that they could get human hairballs. Eating this hair may lead to a large, matted hairball in your digestive tract. Over the course of a few years, the hairball can cause weight loss, vomiting, intestinal obstruction, and in worst cases, death. Dermatillomania is similar, but it involves the skin. Dermatillomania is diagnosed when the person compulsively and repeatedly picks and pulls at their own skin. Examples could include picking at your nails, peeling off your healed scabs, peeling the skin off of your lips, and causing bleeding scratches or bruises on your skin from scratching and picking. In most cases, these patients pick at their skin when nobody else is around. Another symptom of both dermatillomania and trichotillomania is feeling anxious or tense when they can't pull or pick. There are two types of trichotillomania: focused and automatic. Focused trichotillomania is when the person picks at their hair intentionally for a feeling of pleasure or relief. Automatic is where the person pulls at their hair unintentionally as a matter of habit or while unconscious. There are no specified types of dermatillomania, but those two could still apply. The causes of these two disorders are the same. There is a genetic portion to both, and with both disorders, the patients pick or pull when they're anxious. Chronic skin picking and hair pulling behavior often starts with the onset of puberty. A person with high stress levels, trauma, and other neurological disorders like depression and anxiety will have a higher chance of developing these disorders. Dermatillomania can also be associated with perfectionism. Some patients with dermatillomania pick or peel any imperfections off of their body, such as a pimple. Even though we have all of this information, there is no exact reason why anybody would have these disorders. Even though it is still unknown, there are still treatments and ways for people with these disorders to get help. Medication is one. It may provide some relief for these symptoms of the disorders, especially for individuals who are already struggling with anxiety or depression. Therapy tends to be significantly more effective and does not come with the same risk of side effects from the medications. One effective intervention is habit reversal training, which focuses on identifying the client's triggers and coming up with prevention strategies specifically targeted at those triggers. Cognitive behavioral therapy is another popular treatment. This approach typically targets the unpleasant or compulsive thoughts and emotions that may entice someone to pick at their skin or pull at their hair. There are also different organizations for those who struggle with these disorders. For example, the Picking Me Foundation, which supports both trichotillomania and dermatillomania. On the Picking Me Foundation website, you can find so many branched out programs in all different areas for the said patient. Another website is the IOCDF, which is about OCD in general and helps people find things from therapists to support groups and organizations. And now, on a positive note, we've reached the end of my project. I hope I managed to keep your attention throughout. I did the best I could, and I hope that this information was enlightening. Thank you for listening.